Hand, foot, and mouth disease outbreak spreads across 31 Tennessee schools and daycares, nearly 180 infected. Health officials in Shelby County, Tennessee, are racing to contain an outbreak of hand, foot, and mouth disease, HFMD, that has swept through schools and childcare centers since late summer, sickening more than 170 children and staff. The Shelby County Health Department, SCHD, confirmed that the first cases surfaced in August, but officials weren't formally notified until early September, by which time the virus had quietly spread through classrooms and play areas. According to SCHD's latest update, 31 schools and 3 daycare centers across the county, including several in Memphis, have reported infections. In total, 178 students and staff members have been affected by the outbreak. Although the department did not disclose the names of all the impacted schools, Sherwood Elementary in Memphis has been confirmed as one of them, according to WATM-TV, a local ABC News affiliate. Parents there received multiple alerts via emails, text messages, and robocalls, warning them of confirmed HFMD cases and detailing efforts to disinfect classrooms and shared spaces. Quote, "While most cases of hand, foot, and mouth disease are mild," end quote, said Dr. Bruce Randolph, the county's health officer and SCHD director, parents should keep sick children home until they are fever-free, feeling well, and any mouth sores or blisters have improved, end quote. What is hand, foot, and mouth disease? Hand, foot, and mouth disease is a common viral illness, primarily affecting young children under age 5, though older kids and adults can also catch it. The Centers for Disease Control and Prevention, CDC, says the illness is typically caused by enteroviruses, most often Coxsackie virus A16 and enterovirus 71. Symptoms usually begin 3 to 6 days after exposure and last about a week to 10 days. Early signs often include fever, sore throat, fatigue, and irritability, followed by the appearance of painful mouth sores that can blister, and a rash on the hands, feet, and sometimes the buttocks or legs. In most cases, the disease is mild and resolves without medical treatment. However, it can be extremely uncomfortable, especially for toddlers who may refuse to eat or drink due to painful mouth ulcers, raising the risk of dehydration. How HFMD spread so quickly? Health officials warn that HFMD is highly contagious and can spread rapidly in schools, playgrounds, and childcare settings where kids are in close contact and hygiene can be difficult to maintain. According to the CDC, the virus spreads through respiratory droplets when an infected person coughs, sneezes, or talks, touching contaminated objects or surfaces, such as toys or doorknobs, fluid from blisters or nasal discharge, contact with feces, especially during diaper changes. That means even after symptoms fade, the virus can linger for days or weeks on surfaces or in bodily fluids, making outbreaks like the one in Shelby County particularly hard to contain. Prevention and safety measures. To limit further spread, SCHD is coordinating with local school districts and childcare centers to monitor new cases, disinfect high-touch surfaces, and educate staff and parents on preventative hygiene. The CDC recommends several steps to help reduce transmission. Wash hands frequently with soap and water for at least 20 seconds, especially after changing diapers or using the bathroom. Teach children proper hand-washing habits. Avoid touching the face with unwashed hands. Clean and disinfect shared toys, tables, and other surfaces daily. Avoid close physical contact, like hugging or sharing utensils, with anyone showing symptoms. Though no specific treatment or vaccine exists for HFMD, most patients recover fully on their own. Over-the-counter pain relievers and fever reducers, such as acetaminophen or ibuprofen, can help manage discomfort. Doctors also recommend drinking plenty of fluids to prevent dehydration, particularly in children who have mouth sores. School attendance guidelines. Because HFMD typically causes mild illness, the CDC says children can return to school or daycare once they no longer have a fever, are eating and drinking normally, and do not have uncontrolled tooling from mouth sores. However, during large outbreaks, like the one now affecting Shelby County, local health authorities may instruct schools to temporarily exclude infected students or implement enhanced cleaning protocols to slow transmission. Quote, keeping children home when they're sick and maintaining strict hygiene in shared spaces are key to breaking the chain of infection, end quote, SCHD officials emphasized. Community response and public concern. Parents across Memphis have expressed growing concern about the outbreak's reach and speed. Many are urging schools to be more transparent about reported cases and to continue deep cleaning classrooms daily until infection numbers drop. Quote, I got a text saying there were multiple confirmed cases in my daughter's class, said one Memphis mother whose child attends an affected elementary school. We've been sanitizing everything at home and reminding her to wash her hands constantly. It's scary how fast it spread, end quote. Local health experts say outbreaks like this are not uncommon during back-to-school season, when children return to crowded classrooms and viruses circulate more freely. But they also note that community awareness and cooperation can significantly reduce the outbreak's duration and impact. The bigger picture. HFMD outbreaks occur frequently in the United States, especially in warmer months and in childcare settings where close contact is unavoidable. While serious complications are rare, they can occur, especially in infants or those with weakened immune systems. The CDC continues to monitor national trends and reminds caregivers that the best defense remains vigilant hygiene practices and early detection of symptoms. As Shelby County works to contain its current outbreak, health officials are optimistic that ongoing collaboration between schools, parents, and local health workers will help stem the spread before winter illnesses arrive. Quote, outbreaks like this remind us how quickly viruses can move through our communities, end quote, Dr. Randolph said. With careful attention and cooperation, we can protect our children, families, and schools. Bottom line, the hand, foot, and mouth disease outbreak in Tennessee has affected dozens of schools and nearly 180 individuals so far, but with proper hygiene, responsible isolation, and timely communication, health officials say the situation is manageable and expected to improve in the coming weeks.